Welcome, everybody, to the 2020 Robert Wood Johnson Foundation virtual pitch competition for two incredible challenges that we're so excited to share with you today, the presentations for. This is Indu Subaya. I'm the co-founder and president of Catalyst at Health 2.0. And gosh, since 2010, Catalyst has done over 90 of these challenges, including over 20 with our partners at the Robert Wood Johnson Foundation. And we've awarded over $9 million to date. Today, I think it takes us over to $9.1 million. So it's really a fantastic opportunity that we've had to see this innovation come through the pipeline over the years. When Kathy Hempstead, who you'll meet later today at the Robert Wood Johnson Foundation, came to us and said, I'd like to do a challenge to address emergency preparedness. We had no idea that the coronavirus was going to hit America, take over our lives in many ways. And so these two challenges that you're going to see here today really combined the need for emergency response and preparedness to this realm of the pandemic. And we were blown away that on both challenges, the response was of record numbers. So we, of course, had two challenges. The Emergency Response Innovation Challenge asked individuals to develop health technology tools, both for the needs of individuals as well as for healthcare systems affected by large-scale health crises, such as the pandemic or any other natural disaster. And nearly 125 applications were submitted to the General Public Challenge, and over 130 were submitted to the Healthcare System Challenge. We were amazed that these submissions for the General Public Challenge alone involved over 110 different organizations, 14 academic institutions, 3 healthcare systems, and over 400 people participating in these teams. The Healthcare System Challenge was submitted by over 119 organizations, 8 healthcare systems, and nearly 450 people. We couldn't do this without the incredible team of judges that we assembled, over 20 folks, experts in all domains that are relevant here, judged the Healthcare System Challenge, and 13 judged the General Public Challenge. So thank you all, and you're going to meet a number of them on this webinar. So what's happened so far is we've had 5 semifinalists for each challenge. They were awarded $1,000 each to further develop their solutions. And now a phase 2 presentation, an expert channel of judges across the healthcare and venture capital design and emergency response industries have selected 3 finalists from each challenge to compete. And with that, I'm going to hand you over to my co-founder and MC for today's webinar, Matthew Holt, who'll take you through what we can expect today and lead us through the webinar. Thank you, Matthew.
Good morning, Indu. Good morning, everybody. Thanks a lot for that intro, Indu. Very exciting. I want to again give my welcome to everybody for being at this really exciting conclusion to what's been a hell of a challenge year for us and a hell of a year for everybody. And here is the agenda for the day. So we're right now just at the little intro phase. I of course want to thank Kathy Hempstead and the team at the Robert Wood Johnson Foundation. I think this is the 10th year that some of the Robert Wood Johnson Foundation has funded one of our challenges, going all the way back to 11th year, all the way back to 2010. So really fantastic that this has kept going all these years. And we're going to start off the first hour, or not quite hour, is going to be the finalist for the General Public Challenge. So as Indy said, there are 2 challenges, one for applications meant for the general public, and one for applications and solutions meant for the healthcare system and healthcare in the wider sense of the healthcare system. And of course, there's a lot of overlap and sort of interplay between those 2. In between the 2 competitions, so that's going to be the second hour, is the healthcare system one. In between these 2 competitions, we're going to show you something other work that has also had some support from Robert Wood Johnson Foundation. Early on in the pandemic, we put together a very basic website, which has been up for a while, around COVID-19 and what companies and technology vendors were doing to try to sort of support the system in the case of COVID-19. And over the course of the summer, we've been building a new database to make all that information searchable and more attainable. We're going to give you a sort of sneak preview of that, and that database actually is just going live. It's just gone live today. So we'll show you that sort of at half time, and then we'll come back with the second hour. But you didn't come here to listen to me talk about that. You came here to figure out what these challenges are about. So first up was the general public challenge, which was, can you build a health technology tool to support the needs of individuals affected by a large-scale healthcare crisis, such as a pandemic? On the healthcare system side, can you create a tool supporting the healthcare system, which could be any number of people on the healthcare system during a large-scale crisis? So, we were thinking about this earlier, as Indy said earlier on, as to what kind of challenge we're going to run this year. We were going to do one on sort of emergency preparedness anyway, and hopefully the fates came together, not in a particularly good way, but obviously the pandemic happened. So here's the timeline that we talked about. Everyone goes through phase one, all those innovations submitted, and then we ended up with the evaluation phase, and you're now in the last part here, which is the online piece. And all that will be remaining to be announced today is who wins this, which is the check, both $25,000 for each competition is the first prize, and there are also some pretty decent second and third prizes. So everyone will be a winner today. Okay, so without further ado, who we're going to go? This is going to be the next hour. We're going to have 3 finalists: Binformed Covidata, CovidSMS, and Fresh EBT. All different types of organizations showing a range of different applications that are all really crucial, I think, for how to manage pandemic. And yes, they're all highly COVID related, as you might expect. What will happen is each presenter will get 5 minutes. I'll introduce them. They'll get 5 minutes to present, and then after that, the judges will come on. You can imagine that, if we were doing this live, they'd be sitting on stage asking questions. They'll switch their cameras on. They'll ask questions for 5 minutes. There'll be Q&A, and then we'll go to the next presenter. And then the judges will be scoring secretly behind the scenes. So that's what we've got coming up for the next hour. And I want to go straight into our first presenter. Okay, so this is Binformed Covidata. The presenter is Rick Peters. Binformed is a clinically driven, comprehensive infectious disease, epidemic, pandemic management tool, which is targeting overall suppression and containment diseases such as COVID-19. The presenter is Rick Peters. Rick can come join me now. Rick is a veteran of the health IT world. I've done it for many years. He started off, he was the founder and president of Oceana back in the day. This is electronic medical records in the late 80s. Has done all kinds of different things, and is now heavily involved in various roles at the New School of Medicine at UT Austin. But he's hanging out, as you'll see from his app, in Santa Clara, California. And Rick, you have 5 minutes to tell the world about Binformed.
Thank you, Matthew, for the great introduction, and just dive in. Binformed Covidata provides a set of online and mobile risk assessment tools for use by individuals, families, and groups to manage personal health and safety and decrease the risk of contracting COVID-19. Early in this pandemic, we were a bit stunned as clinicians and technologists that the core tools to manage the pandemic were missing. So to address this, we built a comprehensive enterprise class tool set to provide healthcare systems, schools, institutions, and essential workforce employers with a solution to manage their group and population risk. We'd hold those tools up against anyone else, but what we found was that every institution wanted to do their own thing. Every tech company academic team had their own solution, and this led to frustration, low rates of adoption, and a lack of trust and ability to protect personal information. Subsequently, we have a virus now with rapidly increasing case counts, and it's keeping our kids in school at risk and the safety of our essential workforces, our healthcare colleagues, and our families. So we pivoted. And what we did is we built a secure, confidential, and private biosafety tool set for individuals, families, and groups, and it's basically to manage personal and work-related risks. And we modeled it on the successful work by David Weiss and his team at the NBA bubble in Orlando. So to illustrate, there are 4 key components. And let's say I'm a parent, which I am, a 3-year-old child, and I want to keep that child in school. So for those 4 components, the first one is the highest risk to my child is from my wife, myself, or other family members passing disease to her. So we need a simple health assessment tool for individual health risk. And to orient you, at the top of all of our screens, you'll see a health risk assessment. It's a relative risk, and you'll see navigation along the bottom. So this looks at my gender, age, height, weight, BMI, and I can put different things. Let's say I'm a diabetic, I'm on insulin, and you can see my health risk increases if I have metabolic syndrome as well. You can see I have a relatively high risk of COVID. Second, if I or my wife or child feel sick at any point in time, we need a simple way to enter our symptoms to see if we might have COVID-19 or some other condition. So I can enter things such as a mild fever, a cough that's dry, weakness, and you can see it increases my symptom risk. But instead of building a daily symptom checklist, which many of us are using for our kids and such now, we built a tool that applies advanced analytics to clinically calculated differential diagnosis. And this is across the spectrum of pediatric, adult, and geriatric disease. And what we intended to do was not just cover COVID, we cover influenza, URI, otitis media, asthma, allergy, and other disease environmental risks that we're likely to encounter. Third, we need a simple way to assess the risk we incur going about our daily lives, going to school, to the grocery store, to playgrounds, parks, restaurants, and the like. And it needs to be secure, confidential, and private. So these are all the places I've been recently. Let's just select one. And let's say I was at a wedding at this place. I did not wait in line when I was there, but it was indoors. It was not well ventilated. It was crowded. I did not socially distance, but I did wear a mask. And you can see, depending on different types of protection, we have different risk scores associated with that. Fourth, if we wanted to travel, let's say I want to take my daughter to visit her grandmother down in Southern California, we need to assess our travel risk. This is the current overall risk in the US, very high, 3,500 per 100,000, up 31% this week. Here's a risk in Santa Clara County where we are. It's 1,500 per 100,000. And it's up 37% this week. And then San Diego, 2,000 per 100,000 and up 107% this week. So pretty high risk. We have to decide whether we really want to take that trip or not. So these tools are comprehensive. They're clinically driven, and they're built up from the ground up to protect our privacy. We're building the tools we think we should have had before this became a pandemic in the first place. And to that end, I'd like to highlight a few features we've added since being selected for the competition. One, we added a tool for tests and test results. We added a tool for vaccinations. And I think most interestingly, we added something to define asymptomatic risk. It's based on work by Michael Snyder and his team at Stanford, which we had the privilege to work with on an earlier hackathon. And it appears that the elevation of resting heart rate seen 2 to 5 days before COVID symptom onset is one of the best predictors of potential infection, strong indicator for testing. And this is basically my data from today. So we implemented a smartwatch-based heart rate analytics engine and an early warning system for COVID-19 infection. So the way we look at this, COVID-19 is a canary in the coal mine. And the next time we need to be prepared with a whole different mindset and the right tools to be proactive and take control of managing our individual, family, and population risks. And then I'd like to end with a special call out to our fellow competitors, CovidSMS and Fresh EBT. This pandemic has had an unequal and tragic impact on the socioeconomic disadvantage on our country and on our essential workforces. This is critical to understand. CovidSMS and Fresh EBT are addressing critical needs in these communities, and we're honored to be here today and competing with them. We hope we can all work together to solve the problems this disease has created and hopefully provide fundamental change and face what we have to face in the future. Thank you very much. Greatly appreciate it.
Fantastic, Rick. Stick a camera back on, and I'd like to welcome the judges. Come back. So let me introduce our judges. Here we go. They're in. Brenda, can you switch your camera on? So going on my screen from left to right, this is Jotin Gambier. Jotin is a founder and consultant at a company called Secure Flow. He is an expert in compliance, risk management, and deep water technologies around those types of issues. Radha Simavera is a practicing orthodontist. Somehow she's also managed to sneak in time there to be a governor at Tel Aviv University, and she's COO for not one but two at-home care tech startups, MD with Me and Ziffy Care. And Brenda Dalal is a long-time qualitative user experience researcher. She's worked at all the great places, Xerox PARC, Google, and like me, although I didn't do qualitative experience, IFTF, and also like me, Institute for the Future, and also like me, she's a Cambridge grad, although she had a PhD from Cambridge, so she probably took it a bit more seriously than I did. All right. So,
Mehek Shah, one of my colleagues, is on
yes,
too.
Mehek Shah from Binformed, also working with Rick, he's a doctorpreneur, as he calls himself. So we have 5 minutes for Q&A. Let's start with Jotin while Rada's getting going.
Sure. Thank you for the presentation. It was a great presentation. Got a good feel for the product. In regards to both location-based data and health data, you mentioned the fact that it's confidential, secure, and it's not being shared. When you get this information, how does the user register and where does the data go?
We have two modes, really. The original mode we built for enterprises was essentially a full-blown electronic health record, de-identified, highly secure infrastructure with HIPAA compliance, GDPR, CCPA, that we've used over the years for the healthcare projects we've worked on. But for the consumer mobile app, what we did is we made it local to mobile. So we can, in the future, allow consumers to opt in if they want and become secured to, on the web. But right now, it's just secured on the device. And it's encrypted and only available to the user when they're authenticated themselves.
Okay, so there's no delegated administration as far as somebody else logging in for that user, collecting information or looking at risk. I mean, are they sharing the information with their doctors, with their providers?
We can. So on the back end, we have interface with Particle Health and Redox, but that's through the server side. So if a patient wanted to, or a member or a consumer, they could actually do that, and that could go through our server infrastructure, but they don't have to. They can keep it on their phone. And then on their phone, they can manage their family if they want to, or on their iPad or tablet, whatever they'd like to use. So we've given it really these two modes. One is, do you want to just manage your own life and use your own device to do so, or do you want it shared? And if you share it, you control how you share it 100%. It's de-identified, fully encrypted, and meets all the regulatory guidelines if it's on the web. We think trust is a critical thing, judging for this, and I think that's one of the problems we've had with contact tracing is a lack of consumer trust.
That is correct. Yeah, absolutely. The trust is huge these days, especially from a privacy perspective.
Absolutely.
Rada,
those were my...
you ready to go?
Yeah, so looks like I'm unmuted now. So thank you so much, Ray. Great presentation and wonderful idea. As a healthcare provider, I am constantly challenged with questions whether it's safe or no to go to medical offices for hospitals and such. Do you account for any risk associated with visiting medical providers these days? Is it part of your risk assessment?
Yes, we have. In the location thing, you can choose a physician office, ER, urgent care, the things like that as well. And I think you know as well as I do from physician perspective, I'm an ED physician, those institutions and those spaces are now safer almost than anywhere else because we're fully protected and we do that. But the confidence and trust, again, for the consumers out there. So we actually put those risks a little higher because that's actually what the consumers expect. But we don't make it as high as, say, going to a wedding or going to a bar or any enclosed space like that as well. So we've sort of modified that risk based on logical assumptions that you could make. Because again, we really do believe that healthcare providers are doing the best they can. We don't want patients not to go to see their clinicians or their orthodontist or their dentist or anything else like that as well.
Brenda.
Great presentation. This is an amazing project, actually, and I really respect the people, your partners that you're working with at Stanford, and some of their work for personalized care. My question is more in terms of what do you think your first 3 biggest issues are that you'd like to tackle in the first year if you get this funding? Could you talk about them a little bit, please?
Well, let me give you a dream. Our dream would be that we could find somebody who would sponsor us to take this to the audiences that our competitors today are addressing, which is the socioeconomic disadvantage. We have this available in Spanish, for example. That would be ideal. We do know that we can get it into the sort of, my wife and my daughter's mother says that women and mothers are some of the ones that are freaking out the most. We know we could get into that audience as well. But we think getting the confidence and trust of individuals, which is why the privacy is so important, getting them to trust the actual scores that they're getting and understand the utility of it, and then seeing the value of that so we can get traction. And I think that that's a primary thing we deal with across the board. But I think there's a reality check now as we get deeper and deeper into this, sadly, that it's not going away on its own. And I think as we see the vaccine roll out, as fast as they roll it out, it's still going to be extensive in terms of time frame. So we think it's becoming more and more valuable as a tool than we thought before.
Thank you.
All right, we have time for one last quick question, the three of you. I don't see one. Okay, so we will say goodbye to our judges now. Goodbye to.
I have
Oh, Aaron, jump in quick.
as far as scalability, have you tested this for scalability in terms of how many people can you have on this application on the back end from a server perspective?
Yeah, it's built on Amazon Web Services. It's built on an architecture that we've scaled through multiple projects in the past, and we split it with some of it's on Google Cloud as well, so it can scale massively. And we've tested the same architecture with a similar application across hundreds of thousands of users. So we're very confident about that too. And we have great support from Amazon and Google as well.
That's a great last question, Jordan, because they're actually, so just to let you all know, watching people, the judges are now going to often score, and the criteria they're going to score on the 4 criteria are overall impact, innovation and creativity, which is the same scalability, the one that Jordan just asked, how scalable is this, and then the strength of the overall presentation. So that's what the judges will be off to score now. So if we could say goodbye to the judges, goodbye to Rick and Mehek. That was Binformed.
Thank you very much. Greatly appreciate it.
Thanks very much, Rick. Mehek. And we'll move on now. And next up, it's CovidSMS. So I want to, if we can have a camera on, Serena Wang. Serena Wang, Joey Kiang, and Oren Wee. Serena will be presenting. We're now, kind of interesting that I had Rick on as the first presenter, a guy who's been around a long time. This is a team led by Serena of grad students at Hopkins who have built a really amazing tool. CovidSMS is a text message-based platform providing city and locality-specific information and resources to help the really disadvantaged in the time of CovidSMS and COVID-19. So with that, I will get out the way, and Serena, please take it away.
Okay. And also, just a clarification, I'm actually an undergraduate student. So I'm a senior. I'll be graduating college soon, and I'm currently studying public health. So
I apologize. That's
oh, no worries, no worries. No worries.
And somebody on this call will hire you, no question. But anyway, sorry, please take it away.
Hi, I'm Serena Wang, co-founder and CEO of CovidSMS. As a student at Johns Hopkins studying public health and a community leader in Baltimore, I've worked closely with people experiencing homelessness and of low-income communities. While volunteering at a food pantry during the early months of the pandemic, I met a man named Mark. He had recently been unemployed from his custodial job and found himself living on the streets for the very first time. The worst part was that his laptop had recently been stolen, so he had very limited access to the internet. He was asking me very basic questions, such as, what are COVID symptoms? If I have COVID symptoms, how do I get tested? Where do I get tested? And I realized that all of this information I could easily look up on the internet and Google, but Mark only had a basic phone and couldn't get the answers. Recognizing this problem, we gathered a team of students and we created CovidSMS. CovidSMS is a free-to-use text messaging platform that allows community leaders and city officials to disseminate essential information and resources via text. SMS is the most accessible form of communication. Half of low-income Americans don't have access to the internet, but 96% of low-income Americans have a phone. We felt a mission to serve, and so we got a group of students and we built this application in a weekend. Let's run through an example phone number. Let's say Mark is at the Hope Food Pantry. He receives this flyer while waiting in line and follows the directions by texting START to 833-997-0500. So I'm going to pull up my application, text messaging application, and I'm going to text START to the phone number in the flyer. So we are available in English and Spanish. And I'm going to put the zip code of Salt Lake City, Utah, just as an example. And so I'll receive the number of cases and deaths specific to my zip code. And we get all of our information from the Johns Hopkins database. I am looking for testing sites if I am Mark, and so I will text in A. Then I will get the testing sites based on my zip code and nearest location. Next, I can also subscribe to announcements. So if I am a organization leader, for example, if I work at the Hope Food Pantry, I will then receive a login and password from the CovidSMS team. And so I will have access to a broadcasting portal in which I can directly communicate with Mark. I can schedule my announcements and I can type in announcements. And so let's say my announcement is that I have a food event. Would you like to RSVP? And I can ask a question and get responses. So yes and no. And if I indicate that this is a question, I can submit my message. And Mark will automatically receive the text message. Then to RSVP, I could say yes. And so if I refresh my screen, I can see that Mark has now RSVP'd and said yes, that he will be attending my food event. This also allows community leaders to get a head count so they're better prepared. So we have additional customizable features. For each of our partner, we work closely with them in creating a unique user flow that best serves the needs of their community. So individuals can receive access to other crucial resources such as mental health resources, rent assistance, and unemployment information. Our two-way communication feature greatly helps community leaders have a streamlined and accessible method of communication. Our team also handles the maintenance of the number for each of our partners, meaning that they don't need to have the technical expertise in order to use our platform. Just 6 months ago, we were nothing but a team of student volunteers with an idea and a few $1,000s. Now we have over 8 partnerships and more than 6 functionalities, serving over 3,000 users across the United States. One of our partners, the Family Rescue Center located in Los Angeles, told us that our service was game-changing, as they are now able to reach over 700 of their clients and distribute over 65 packages of food almost every day. With the growing digital divide, CovidSMS is needed in vulnerable communities, and we hope that you can help us grow. Thank you.
Fantastically done, Serena. Very well done. Excellent. Can our judges come back, please?
Thank you so much, Serena. Interesting project. What do you see as your immediate next steps on this project?
I think one of our biggest concerns right now is we're really actually running based on Twilio credits to pay for the cost of our text messages. So we've been using the Twilio credits and also from the $1,000 grant that we received as semifinalists. But we actually have a huge partner coming up in which they serve over 30,000 people in the San Jose area. And we don't have the money to cover the costs. So our next step is to really partner with this next partner, a huge partner, and do it successfully so that we're able to start, I think, generating our business model in which we ask these partners to be covering their own costs.
And how are you planning on doing? Do you have a plan on who you're going to pursue in this capacity?
Joey, do you want to take that?
Yeah, so Our plan is to start charging on a per text basis to our partners. Obviously, with larger partners, we'll be able to generate more revenue, and we hope to eventually use some of these profits to also offset the cost for our smaller partners as well. Currently, a lot of the organizations that we're in conversation with are critical to their community, but they themselves don't have much existing communication infrastructure or their own funds to create something on their own. So our goal is to be able to create this business model in which we give them a very flexible way of paying on a per text, per user basis, rather than a bundle that they can't get out of or a contract that may be more difficult for them to work with. And the organizations that we're specifically targeting are these smaller ones that really know their community best and serve niche populations that otherwise would not have any resources during the pandemic.
I just want to clarify that question from Dr. Sumareva. Yes, the partner we're talking about, we're in the final stages of solidifying it, and we've been working on it for months. So yeah, it's a real project that is going to happen.
Joseph. Brenda, where do you go?
Okay, a very quick question. So say if you were able to get funding tomorrow to support this, how much time would you actually have to dedicate to build this platform out?
That's a great question. So I'm actually graduating college early in order to fully invest my time in this project. So I have set out and saved to put a year into CovidSMS, and my efforts in getting all of my classes in this semester is really so that I'm able to dedicate my entire day to CovidSMS.
That's amazing, Serena. I'm really amazed. Congratulations on planning to do that. And who would your team be to accompany with you? Are you thinking about having part-time people on staff, or will you be able to hire others as well to join you? Like, how quickly would you be able to ramp this up?
So I think actually two of our other, my co-founders, they're also graduating early. And so we have decided to dedicate the spring semester. They have decided to dedicate the spring semester to this project. And I think when it comes to hiring, the only real technical need would be our developers. So when it comes to new functionalities, currently it's all based on volunteer computer science students. And so they work on it during times that they can when they're not in class. And so I think that is where we would look to maybe hire a part-time developer, but also understand that 3 out of 4 of our co-founders are taking this semester off to work on it.
Justin.
Well, yeah, great presentation, Serena. That was actually quite an interesting solution, and you actually related back to the people who you're using it. In regards to your database for individual clients that you have, Los Angeles, San Jose, how do you maintain that in terms of scalability? Is it in the cloud? Are you collecting all those telephone numbers and you're broadcasting these messages? How do you do that? What's the technology behind it?
So I personally am just a public health major. All of my technology questions I give to our tech leads. But from my understanding, we use Google Cloud. We use a Google Cloud infrastructure to hold all of our information. With scalability, our computer science software engineers are currently working at Amazon. I have no doubt in their ability to be able to scale this up. And so I think that with the infrastructure and also with the additional funding that we may receive, we will be able to better understand the capacity when it comes to technology and our infrastructure in that sense.
Okay, excellent. And in terms of resources, are you also collecting all those resources in regards to food pantries, what you're providing to them, clinics, etc., in their local communities? Is that also in the same database?
Yes, it's all in the same database. And the way that we're collecting the information is that we're having meaningful relationships with all of our partners. And we ask them where they're typically sending their community members to. And so we actually, in the early starts of the pandemic, we had this database from just a zip code specific like food pantry database online. And we had that as part of our service. But as we were going to the community leaders and telling them about our food pantry option, they were telling us that none of this information was actually where people were going, because it was large scale food pantries where you actually weren't able to go and pick up food. It was just a donation site. And so we realized that we immediately took it off and we started asking community leaders, where are you sending people to get food? And so we added that into our database instead.
Interesting. Okay.
I will just add one thing. I will say that, SMS technology is inherently scalable. It's inherently high volume. And that's kind of why we picked it in the first place, is because it's accessible and because we can scale up to massive proportions. And so the data is very easily storable in Google Cloud, and it doesn't use up nearly as much infrastructure as other forms of storage.
So you're using primarily Google Cloud, not Amazon. You mentioned Amazon Web Services, but you're not using it. Okay. Thank you.
All right. Thanks so much. Okay. Thanks, judges. Thanks to the CovidSMS team. Excellent presentation. And we're up now with our last one. So if everyone can go away, switch their cameras off. Fantastic. And next up is the final in the category of emergency response for the general public. Stacey is with Propel, which is a company which has created the Fresh EBT, and I won't steal our thunder by saying too much about what it does, but it's it was something that I was introduced to, believe it or not, in a podcast from my favorite author, Michael Lewis, who runs a great podcast called Against the Rules, when he's not writing about the blind side and Moneyball and that other stuff. Stacey's colleague was there introducing Fresh EBT, and lo and behold, a few weeks after I saw that podcast, Fresh EBT was one of the finalists in this contest. So Stacey, please take us away and introduce Fresh EBT.
Wonderful. Thank you so much for having me today. And what an impressive group, and an honor to be here with you all. I've already learned so much and have many ideas, so look out to hear from me. Today, I'd like to introduce you to Chanita, a mother of 6 and one of the 40 million households across the country who use the SNAP program, also known as the food stamp program, to feed their families. Mothers like Chanita have told us, my hands are literally full. So the standard option to check my balance by dialing a 1-800 number, entering my 19-digit EBT card, and all of the prompts before and after every shopping trip while I'm at a store shopping and managing my kids is not an option for me. But I have a smartphone. So Fresh EBT reimagined this experience so it looks and feels more like a modern financial tool. Fresh EBT is a free app that is free to download and free to use and available on any smartphone. I'm going to try to switch over to a demo now. So now that I have Fresh EBT downloaded on my phone, I've logged in and saved my username and password so I can see my balance with one click. I see that I have $450 to spend this month, but I often worry about when I'm going to get my deposit. Can I rely on this? And otherwise, I was calling a 1-800 number over and over again at midnight, but can see here as soon as my deposit is received. I can also check and make sure I was charged correctly. I wasn't double charged at a retailer, and I can sleep better with this ease. In addition, I can use Fresh EBT to see a map of local retailers, food pantries, WIC clinics, other relevant resources, check recipes for within my healthy eating within my budget, connect with coupons at local retailers to save money, and apply for jobs. But in March, my world, like so many other families, turned upside down. Not least the families with limited income using Fresh EBT. We started getting questions right away about changes to benefits, new federal programs intended to keep families afloat. What am I eligible for? What am I missing? And most people didn't know about them or how to use them. So in response to the pandemic, we created a benefit program update center that we have been updating daily since the start of the pandemic, with additional SNAP benefits called max allotment, PEBT benefits for families whose children were otherwise in school, and other benefits that families need to know the right next step to take in order to receive. So for example, you may have heard of the economic impact payments, the stimulus checks that were sent to families. Many families, maybe some of you, received those direct deposited into their bank account. Wow, an extra $1,200, that's great. For families using Fresh EBT, over 50% report having less than $25 available to them. $1,200 is life-changing. But these families were poised to miss out on this payment entirely because they hadn't been required to file with the IRS, didn't have bank account information attached, and didn't know they needed to take a step in order to receive the payment. So we shared that information within Fresh EBT, as well as links to each of the IRS forms for families to track their current payments and or to fill out the non-filer form or take other steps to make sure that they receive their payment as quickly and efficiently as possible. Another example is we had families who were at risk of being evicted and had heard that maybe there was something about an eviction moratorium, but didn't know what that was, if they were eligible. Similarly, share information here within Fresh EBT about the CDC eviction moratorium and partnered with a legal aid organization to share a tool that connected households to legal aid services, as well as a form to fill out right here on their phone in less than 2 minutes that would automatically send a letter to their landlord to stave off eviction. And we saw over 3,000 households use this in the first month that it was offered. We built Fresh EBT to give families more control and to bring the same modern, dignified tools available in financial services to government benefits. All of these tools, especially access to the right info at the right time, mean benefits stretch longer, on average 2 days longer a month for households using Fresh EBT. But it's not enough. Now we hear from households every day who are deciding between feeding their oldest chicken and buying formula for their baby. Or do I skip my utility payment or push back my rent this month? And I'm so grateful to know the economic impact payment is coming in a few weeks, but my rent was due yesterday. At the same time, we heard from donors. They wanted to help, but didn't know where to start. So we created $1,000, no strings attached cash payments distributed through Fresh EBT. Households see this yellow bar come up, answer a few questions, and within a few hours receive a $1,000 no strings attached payment. We've distributed over $115 million in these payments since March. And here we get to meet Janita again, who told us, I plan on catching up on my rent, light, and water bills with my check. This is a once in a lifetime thing. Thank you all again for the time and look forward to continuing the conversation.
Wonderful, Stacey. Thank you so much. If I could have the judges come back. That's, to my mind, a perfect application of a tool that already was there, already existing, and you've added all these great services on top of it. Fantastic. So hopefully Brenda can come back up, but let's, if you're ready to go, Jonathan, if you're off mute, why don't you start?
Sure. Great presentation. Very seems like a very practical solution for the marketplace. In regards to the information that you collect from the EBT food stamp program, where does it get stored and how do you scale that from the back end perspective? Is it in the cloud? How do you give me an idea as to how do you manage that?
Sure. So Fresh EBT works today anywhere an EBT card works. So any EBT card holder can log into Fresh EBT and check their balance. The balance information is different from the other content available in the app. So the balance information is the user logging into his or her own account, which is a portal maintained by the EBT processors who run the back end of the actual card that families use to make payments. So that's all immediate and up to date and stored on the EBT processor servers. And then the last download is stored on the user's local phone. So we don't store any user personal information, and they can access that information in real time. All of the content we source from a variety of different places. So this is our social mission and our business model. So some of those content partners are paid advertisers that we vet to make sure that they're high quality and improve financial health. So we're not an open advertising platform, but we handpick all of those partners. But they provide that content, and then we host our content on AWS services. So we can scale quickly as we need to.
Excellent. Thank you.
All right, Radha?
Yeah, sure. Thank you so much. Great idea, great presentation. Do you have any geographic prevalence right now?
We sort of follow the EBT program. So we have households using fresh EBT in all 50 states. Generally about 20% of the EBT population in any given state. So the largest number of households using fresh EBT are located in the states with the largest SNAP populations: California, Florida, New York, Texas. However, we have users anywhere an EBT card is used, fresh EBT is used as well.
And the identity proof, do you have any kind of identity proof inbuilt in the system? Making sure there's no, for users, just making sure there's no fraud. Yeah. Mm-hmm.
That's right. Yeah. So we sit on top of the EBT processor system. So when a EBT user uses the same username and login, they would to log into the EBT processor portal. And so they authenticate and hold all of that information on their end. And we sort of pass it through in a fully encrypted way and pass the information back to the user's phone in a fully encrypted way. And the user can store username and password on his or her phone in a fully encrypted way to have all of those security measures. We don't keep any personally identifying information because we would never want to add risk to the system. So we don't ever have that.
Brenda?
What an amazing presentation and solution here, Stacey. It's really impressive. What impressed me particularly was the fact that you've got ties in so many different areas in terms of food security, housing security, and information transparency. There's also a component of basic income here. So it looks like it meets real needs. The question that I have for you, I've got a couple of questions. First of all, who is funding you now? Would you be able to share a little bit about that?
Sure. So we have a variety of different funding sources. We grew out of an anti-poverty foundation called the Robin Hood Foundation based in New York City. That's where we started. So that's where our money started. Now we have a collection of investors from Serena Williams to Andreessen Horowitz to Omidyar Foundation. So typical investors, atypical investors, social impact investors. Though we run a business model to help sustain this service and ensure it can be free to households, and we do not sell to states or to governments. We're not quite there in being in the green, but so we have a collection of inputs to make sure we're able to sustain and grow this service and respond to a real need in real time.
Super. And how many users are using your system right now across all the states in the US?
So 4 million households. We count by households because the EBT card is connected in that way. So we have over 4 million households. We've doubled since March.
Okay, great. Thank you so much.
Thank you.
All right, well, that's the 5 minutes of questions from our judges, and they're fantastic. Thank you very much, Stacey, and the folks at Fresh EBT Propel. Thank you, Jordan. Thank you, Radha. Thank you, Brenda. You are now going to go off, and there's a secret behind the scenes channel where you will work with Elizabeth to do your judging, and we are going to change pace. But I just think, as a general, and I can invite Indu Savaya to come back and join me. Brenda, can you turn your camera off? Here's Indu. There we go. But just a general comment, Indu, that, I mean, that, we've been slacking back and forth. What did you say? You said that was quite the contrast of what we've done in our challenges between, you've got the venture funded company for Andreessen Horowitz, you've got Rick Peters, who's been around for, sorry, Rick, been around forever, and we were working with back in the 2000s, and a gang of undergraduates. I mean, what a fantastic contrast.
Absolutely. I think it's such a pleasure and an honor to level the playing field for entrepreneurs, and somebody that's an undergraduate can, compete and really make as much impact as somebody who's an industry veteran. And I think we're proud of everybody that presented so far today. So fantastic. So Matthew, we are transitioning to a interlude here where it is my pleasure to share something that Catalyst has been working on that we see as a complement to the efforts of all of the other entrepreneurs in this space who've been building out solutions to address COVID. So it was sort of the first week of March, and I think March 8th was when I officially kept my son home from school. I think we kind of knew what was coming. And that week, it just didn't make sense for us to sit around and do nothing. As Catalyst, we've been supporting this space for so long. So we asked ourselves, what could we do? And one of the things we knew we could do was create a forum for health tech entrepreneurs to showcase their work. And on March 17th, furiously working over just, I think, 3 or 4 nights with our developers and our small team, we put up something called COVID19healthtech.com. And we put up about 12 companies that we knew were working in the space. This was the first responders, if you will, to the emergency response. And we put up a form and we said, if you're working on a solution for COVID in health tech, tell us about yourself. Within a few days, we had over 139 companies come and tell us about what they were doing. Some were brand new companies that were starting from scratch. Others were large players who were pivoting with a new product or solution to address the pandemic. And this little blog site began to gain attention. We actually started to categorize these companies into some of the categories that you see there: the testing, mental health, behavioral health, diagnostics, analytics and tracking, AI, and more. And these companies kept coming and telling us about themselves. And Matthew, I think you want to show maybe the open calls. At one point, we even launched a mechanism to say, if you have a need as an organization or a government for a health tech solution to address the pandemic, you can go ahead and put out a call. And we tried 2 open calls, just, quick summaries of needs. And we had, for the first one, through Brigham and Women's, over 100 companies apply. For the second one that we're running right now, we have another company that's already formed a partnership with an organization to address some aspect of this pandemic and to serve underserved markets. So we were really excited that we were able to make this difference with just a small website. So we went to Kathy Hempstead, again, all roads lead to Kathy, and we said, we're working on this space. We'd love to expand this platform to showcase these entrepreneurs more. And Kathy was extremely supportive. And we said, rather than go from a blog site, we want to do something a little bit more robust. And so today, for the very, very, very first time ever, we'd like to debut the new front end to this platform. And I think Matthew will take you through it more, but let me quickly set it up. And so we transformed this blog site into a platform that's a database backend that has the ability to search, filter, and find companies that are working specifically in COVID response. And Matthew will show you a few other exciting features.
Here is the old site, which actually is still up. And as you see, we created a series of categories. So if you wanted to look at diagnostics, all the companies we put on this, and this is a very simple Squarespace site, there is some information about the companies. There's a large number of companies in this database, over 300 in this site. And you see we have a little bit of information about each one of these companies, but it's not really that helpful. It's not really that searchable, that useful. So what we've built on top of some work that was previously done is what we're now calling our source database COVID edition. So couple of things to mention as we go through this. First off, we still have our announcement here. This is now open and available. You don't have to log in to see most of this. I'll explain to you what you do have to log in to see in a minute. But what we've done is we've taken those categories that you may have noticed before, and they're all in these bubbles here. As I said, we are still asking people to give us their information. So you can look at this announcement at the top here, and please, if you're working on a response, you're not in this database, let us know. If you're a provider, a scientist, a policymaker, or somebody else who's expert, again, please let us know. We are still gathering information here. But in general, what this side is the source database has a little bit of the news. You saw there was some news on this other side, some articles, some updates, even some videos provided. For example, here is a video. Actually, it's a bit slow today. I was going to show you a little bit of video here that is in the site. because when I get there, I'll show this the video that Indu presented at. Oh, that's actually not Indu, that's somebody else. There she is. This is Indu, you can see her presenting from her living room. All right, you get the idea. We're also able to have at source information is new and notable, so you can do this by various different categories. Here are some of the companies in the database. Here's some in data visualization. But we really get to the power of the database, which is to look at a range of different companies at one time. So let's say that you're interested in impact of an artificial intelligence tool to help with COVID. Well, you can go here and look at the and take a search. And this is searching on a bunch of tags we've done. Here are a number of companies. You'll see there are 64 companies who we have data on in this information about in the COVID-19 world. And here are a number of them. And if you wanted to see more, you just scroll down over the show more. So let's take one at random. This is Giant, and I'll show you a bit about how this works. So here's Giant. It's a company based in San Francisco. Brief description about what they do, and then here's what they have done in terms of COVID. So you'll see the company Giant and the product are actually different objects in the database, which means things like that if a company sells a product to another company, we can track the product between companies. But you'll see that this one is a product, which is the Giant COVID-19 Emergency Response Assistant, and there's some discussion about the launch of the product, where it's deployed, and as you see here, it's tagged as a COVID product, and you'll see it's associated with the company Giant. So that's a simple way of doing it, but you can imagine it gets more complex. We also have more stuff in here, so some information about where you find this company, and that's all available publicly. So let's say you wanted to, I don't know, you want to know a bit more about this. We have the ability that you could follow this company. I want to follow COVID, and it's going to tell me, hang on, you can't follow COVID because you haven't logged in. So come and log in. Now, I obviously can register. I've already, as you might imagine, registered for this site. So I'm going to now log in, password finder. Now, if you log in, it takes you back to the beginning, I'm afraid. So I have to, it doesn't want to me immediately back to it was. So it'll wrinkle of the site. But if I come back to Giant and say, okay, I want to know a bit about Giant. I want to follow them. Now I can follow Giant. So if I go to my little browser here, I'll say, okay, here we go. So I'm now following Giant, and I'm following Big Health. And as time builds, any updates to my activity, to Giant's activity, will appear here. Or I could say, if I'm done with this, I could mark it as, I could unfollow, or I could potentially stop following if I don't want to see more about that. So that's one way you might look at it. There's another way of looking at here, which is just to generally explore. And there are a whole range of companies. You can see companies in all kinds of different ways. This is all of the companies that we currently have in the database, and all the products. But let's say I was interested in I don't know, in thinking about something that perhaps in the guise of I don't know, communications. I think there's a communication tool. Let's see if there's a communication tool in the database. And here we have a number of different ones. So for example, you could then drill down into all different, there are 12 different companies in this guys. So, you get the idea about how you could then drill in and find more information about particular companies that we categorize in that particular way. So you can still, of course, search in still more ways. You can search directly for a company. So let's say you wanted, I was particularly interested in Conversa Health, a company I know pretty well. Let's go take a look at them. Here is Conversa. They have a bit of information, a conversational AI and analytics platform. If you scroll down at Conversa, now I'm logged in, I can also see some people involved with Conversa. Mark Brzezinski happens to be the CEO. And I can see they have two products here. One is coronavirus health chats, which they converted early on, and then later on they built one for employees. So I want to go look at the employees one. I'll find some information here about the products. And I've even got website of the employee of the product itself. So I could now open that up, go off and look and see what their actual information is. It comes up. My internet is a little bit slow today, but there you go. Here's more information directly from the company. The last thing I'd show you is the concept of doing. It's the concept of doing. I'll go back to the main page. The concept of doing a search. So I can perhaps do testing. Better if I can spell. And I can either search by name, which will bring up, we know these companies because they have testing already in their thing, or I can actually search the whole database by keyword. So if I was to search by keyword, now, these are all the companies who somewhere, 30 companies who somewhere, beyond products, somewhere have testing, you know, in their somewhere in their description. So Dispatch Health, for example, you may not have known about this, but Dispatch Health was doing testing, and there you go. It's doing an inventory of testing equipment and testing capabilities in place. So a pretty robust way to look at all of that information within the database. And if I'm really interested in keeping this search going, looking at the products now, let's say I want to look at the companies, all the different tests, for instance, it's UDO test or Everly Well, still believe it's at-home testing, let's get checked. I can actually save this search. So I've got the 71 results search saved. And if I was to come back later and look at my saved searches, I'll see I have two saved searches. There's one for home testing last night, there's one for testing today. So that gives you an idea of some of the power of the ability to use this kind of a database to find out more and keep on track with what's going on. And you know, as I'll end the demo there. But Indu, if you come back and join me, we have some strong ideas for what we're going to do to build onto this. Stop sharing my screen. There we go. We have some strong ideas for what we can do to increase our ability to make this, you know, even more user-friendly and increase the connection between users of the database and the companies who are in it.
That's right. Our big goal at Catalyst has always been to broker meaningful connections in the industry. That is the name of the game. And through our developer challenges that we're talking about today, our pilot programs, our industry tracking, it's always been about not just giving information to the industry, but helping companies find their partners and vice versa, and then really helping to distribute and have maximum impact of those solutions. So you'll see that this is not just sort of a Crunchbase kind of platform, but it's beginning to have the ability to follow companies, to save your searches. Soon we'll be rolling out the ability to sign in as a company to see who's following you. And we really invite every single stakeholder, whether you're an investor, a government organization, a nonprofit, and a tech entrepreneur, to come and to participate in this platform. So what some of you might know is that in, I think, 2011 or so, Matthew Holt was very instrumental in designing and launching our entire source database, which consists of over 5,000 companies and something like 6,500 digital health products in 19 categories across the globe. So that database is currently just an internal proprietary database that we use for a number of our innovation programs. But the vision and the goal is to transform this coronavirus specific platform to include the universe of digital health solutions. And that is what we as a team will be working very hard on behind the scenes over the next coming months. And we really, really invite your participation and feedback. And I think Matthew showed you that at the beginning, Matthew, if you are able to share screen again, but if not, we'll be putting this link in the chat and sharing with everybody. But if you're able, there is a little form that says, if you're an innovator, please fill out information. You can also edit a company. We will, of course, monitor those edits in a queue and be the final administrators of that information. But you can log on as we speak today. And if you're not on there, get on there and let us know that you're working in the space. Thank you so much.
Thanks, Indu. Okay, so that's our little intermission, and now we're going to go back with the competition. So now we have 3 finalists, and this is the Healthcare System Innovation Challenge side of the piece. We have 4 judges for this one. I'll be introducing the judges after we start. But first up, it's going to be the 3 finalists: PathCheck Foundation, Cuventus, and Tietros. Okay, so let me start with PathCheck. PathCheck's a non-profit. It's just spun out of MIT. It's one of those, it's done pretty well in terms of recognition, has a lot of well-known advisors, like John Brownstein's an advisor, John Lamka, several others, already working with several states and several countries. It provides a privacy-first, open-source solution for public health, basically supplementing manual contact tracing, visualizing hotspots, interfacing with citizen-facing privacy apps. And Ramesh Raskar is running PathCheck. You may have seen him in his famous TEDx talk about the camera that can go around corners. He's not going to be talking about that today, but it's well worth a look. You can Google that one. But Ramesh, the floor is yours.
Thank you, Matthew. I hope you can see my screen.
Yeah, we're good.
Thank you, Matthew. This is pandemic response is in a disarray. Unlike other crises where you can deploy a top-down solution, pandemics are about innocent people infecting other innocent people, and that's why we need a participation of every one of us in the healthcare system. And we have a solution in our pocket. And so today I'm going to talk about participatory epidemiology that can assist public healthcare systems so that we can reduce the spread, restart the economy while maintaining privacy and trust. So PathCheck Foundation is an MIT spin-off from a group at MIT. We got started and we raised a few $1 million. We are official app in 5 US states and territories, as well as 3 nations. And very quickly, we have become the world's largest open source nonprofit project for COVID-19 with 50 full-time professional volunteers and over 200 other experts working in our ecosystem. And so I'm very proud of a team that's made up of former CEOs and CTOs and folks that are who are really passionate about taming this pandemic. Now, when we think about public health systems for test, trace, and vaccinate, the focus is on aggregation and data for planning, like case management, spread analysis, and so on. But as I said, we also need participation of individuals. And if we can create this participatory system that has a constant feedback, then in fact, although users get specific benefits such as exposure notifications and symptoms and testing services, what they can provide back to the population health system will be in real time, it's personalized for those users, and capture rare events, which would be missing in traditional epidemiology. And we want to achieve all of this in end-to-end privacy-preserving analytics and insight. So let me show you how our app works. So this is an app that's live in one of the states where there's an official app. Start with screens, talks about privacy, exposure detection, trends in that state. If it tested positive for exposure notification, is based on the Google Apple privacy preserving exposure notification system. Exposure history, if somebody has come in contact with you, speak with the contact tracer, next steps. And this is how it can become part of the public health system, and of course your symptoms as well. And this can all be seen on a dashboard for public health. Now, the individual's experience through these different phases of tracing, triage, testing, quarantine, and very soon vaccines is pretty complex. And the challenge for us is how do we achieve this population health solution in a decentralized and privacy-preserving way at every stage, not just for self and public health, but also for employers, services, and tourism, and so on. So in that sense, we really need kind of a ways for public health. And this privacy preserving is not just by throwing words like HIPAA and GDPR and CIPA, but it's computational privacy by using techniques such as differential privacy, multi-party computation, on-device computation, secure enclave, and so on. So it's really a computational privacy and not just privacy by promise or regulation. So as you can imagine, to go beyond a pure exposure notification, we need to build a much more sophisticated solution. So let me show you how this would function in terms of the system, and how population health solution would do that as well. Again, all the screens are tied to the public health system, so that in a privacy preserving way they can get these symptoms or pre-existing conditions and so on. So the user can create a random code for themselves and chat with PHA while maintaining complete privacy and trust. No raw data is ever shared with public health. Complete anonymity here, and same thing with testing and getting the results as well, which is, as you know, is a huge confusion about that. And as you continue to progress through these conditions, your symptoms that may be okay for on day 8 and day 9 and day 10, but could get worse on 11 afterwards after 14 days or so. And when there's decline in health, the public health has a full-fledged dashboards that can see how many people are in isolation, how many people are in quarantine, and they can keep a track of the progress of this system. So this privacy-preserving aggregation is a key aspect for that. And in terms of impact, on device, it's passive, active, and sub-public information available. But we really want to create this decentralized learning healthcare system that can provide insights, foresights, and planning tools, recognizing gaps in the system, vulnerable groups, hidden outbreaks, and improve epidemiological models, and so on. So let me show you the dashboard for what this looks like. Now, most of the jurisdiction we work in actually end up using Salesforce or Tableau for their own visualization. But here is a kind of a path check AI platform where for different state, we can zoom in with different zip codes and take symptoms, COVID-like illness symptoms. But more importantly, also look at relationships in symptoms. For example, we have found by drilling this data that cough and shortness of breath are actually not as correlated with COVID-19 diagnosis as is known in the general knowledge. And also the relationship between different symptoms can also be analyzed by public health officials coming from this private data. So to conclude, pathcheck.org is for participatory epidemiology, ways for health systems. The innovation is privacy-preserving crowdsourcing, not just by regulation, but by computation and computational algorithms. Our impact is on vulnerable groups, outbreaks, and for planning, and for users, it's for real-time personalized guidance. In terms of scale, as I said, our app is already in 5 different states and 3 nations. Our 30 million plus population has access to it. And because we are nonprofit and open source, we have a pretty large alliance of partners who are creating multi-stack solutions on our platform. In future, we want to continue to expand this, especially as we have home tests available and vaccines for safety and efficacy, and creating tools for pharma and for distribution, as well as these systems will be critical for any future threats and emergencies, as is the intention of this group. And with the support of Robert Wood Johnson Foundation and partners here, we hope participatory epidemiology will become part of standards, become part of policy, and in a nonprofit, open source, open standard manner is deployable to everyone. Thank you.
All right, thanks, Ramesh. We're a bit over time on that one, so let's grab our new judges up, please. So our new judges come. Yeah, I see Mark, I see Till, and is Chris there? Well, let me get introducing Mark and Till. I see Chris as well. All right, fantastic. So, sorry, Mark. Michael. Mike Anderson's a pediatrician. His resume, sorry, got his name wrong. Resume is way too long to detail, but most recently he was the CEO at Children's Hospital in Oakland. He's now a senior advisor at the US Department of Health and Human Services. Till Jolly is a longtime emergency room doc. He's been a consultant that held official positions in the government, including emergency preparedness at Homeland Security, FEMA, now he's senior consultant for emergency for ASPA, which is the Secretary of Preparedness and Readiness. And his day job, he's the Chief Medical Officer at the National Security and Health IT consulting firm, Veshka. And Chris Malinuk is the President of Private Provider Solutions at Verge Health, where he's been building software and solutions for compliance, patient safety, and provider management for more than 20 years. And I think we are missing Amul, so we'll go without him for now. Oh, no, he's not. Okay.
And
right,
I believe the chef is online as well. Yeah.
I'm sorry, what did you say?
And some other of our team members are here as well, but just wanted to.
Oh, right. Here's Kasha Dominguez from PathCheck. Fantastic. Okay, so let's do a real quick rapid fire round here. Michael, your question for Ramesh?
Really great presentation and fascinating technology. And mine is less technology and I guess more either sociology or communication. You started off the presentation talking about rebuilding trust. And as somebody that consults with the federal government, trying to rebuild trust in the system and the process, and we are really all in this together. Have you had focus groups or figured out ways to increase adoption? Because in my own personal world, I've had both colleagues and friends say, this feels like Big Brother and this kind of technology is way too intrusive for me.
Yeah, you're absolutely right. My own research at MIT is all about privacy preserving technologies that get into trust and inclusivity and ethics. So yes, in fact, we're the first group in the nation to write a paper called Apps Gone Rogue, Unintended Consequences, which is actually referenced by CDC when they recommend it to states. So we were the first one to come out. So you're very right that trust issues, whether we have computational privacy underneath, are difficult to overcome. And so we have worked with many partners with ACLU, EFF, and of course, our partners in different states. And it's a slow process, but I think, I think as a society, we're coming together to realize that. But we are going well beyond classic GDPR and regulatory and HIPAA considerations. And we are saying this is computational privacy, that even PathCheck cannot see that data. So the whole idea is, how can you ask questions as a population health or a public health? How can you ask questions about data that you cannot see, which is locked away on the smartphones? And this is the new algorithmic world we live in over the last 3 years, where we can that's the world we live in, computational algorithms. If you have heard about federated learning, split learning, and so on.
Maybe I can add something to it, that we are partnering with public health authorities, right? Because the solution is, it's an app connected with the dashboard. We are kind of training also public health authorities and helping them out how to introduce the solutions and merge them with traditional manual contact tracing. And because it's like consistent and maybe only managed by public health authorities, when the app goes on the market, it's announced by the state and by public authorities, and it also builds trust. Yeah. We are not the one that are launching the app.
That's a good point. We are an open source, open standard platform, and the solutions themselves are launched by the states and countries. But of course, we provide end-to-end full stack solutions.
Fantastic. Till?
Yeah, Mike actually asked a version of the question I was going to ask about user adoption. I think one question, and sort of a more technical question, you may have addressed this a bit, is how do you deal with low bandwidth environments, which there are more than enough of in this country?
Yeah, actually, that's an issue that's very close to us. One of the teams from Africa, actually COVID, has joined forces with us, and we're creating this QR code-based solutions that do not require the user to actually carry a phone at all. Of course, if there are feature phones, that helps, so because we can send them an SMS. But somebody in their family could have, or one of their community leader can have a phone, and we can provide the solutions for them. So as long as they're part of the system, they don't have to carry the phone. But of course, our solution is most impactful when there are smartphones. But we do have the spectrum of solutions that are very important for the sake of inclusivity. In terms of adoption, sorry, go ahead.
Okay, we have 30 seconds left on Chris to have a quick question, and then we're done with this section. You're on mute, Chris.
Wonderful presentation. It's a fascinating deployment, quite honestly. I'm curious, so I get the user adoption. How are you partnering with these other health agencies and what's the enticement for them to do this? I mean, it's certainly public health, aggregation of data, et cetera, but how are you getting them involved?
And you have 10 seconds to answer.
Majority of our adopters are actually states and nations, and so they launch the solution with us, and then they partner with in-state employers and so on to provide value-added services. So the thumbs up comes from the CIO of the state, of the organization.
Yeah, but to add to your question,
that's it. I'm afraid that's all the time we have for this section. So I want to thank the judges. I'll see you come back. Thanks, Kausha. Thanks, Ramesh. That was Path Check. Okay, you're good to turn your cameras off, Till and Chris, please. Turn your cameras off, Ramesh and Kausha. And now I want to invite up Jeff and Anthony. Jeff Manson and Anthony Mormon. Anthony Mormon. Sorry, Mormon. Anthony is from Covidata, which is a patient automation solution. So they basically use AI, behavioral science, and all of other clever tools to help healthcare systems. It's a great sort of Silicon Valley startup story, data analytics. They've raised over $45 million. They have a lot of healthcare system clients, as you've seen, and come March, they introduced a whole bunch of new tools, which we're going to now see to help hospitals deal with the COVID pandemic. Anthony, take it away, please.
All right. So today I'm going to talk about how Covidata is helping over 1,100 organizations manage through the pandemic. We are the first real-time operations solution for healthcare. We combine AI, behavioral science, and operations management best practices to improve healthcare delivery over 120 organizations around the country. When COVID hit, we worked closely with our partners to develop a suite of new solutions to help them manage through the pandemic. The solutions include both capacity management tools as well as critical resource planning capabilities. For capacity management, we created two solutions. First is the critical resource mission control, which gives real-time visibility into ICU, negative airflow, and ventilator resources across the system, spanning multiple facilities or instances of EHRs. This allows users to look system-wide or drill down into individual buildings to better load balance and optimize resource deployment. Next, we've got the capacity creation solutions, which use machine learning models to identify 25% more patients who are ready for step down or discharge than care teams normally would. Finally, we've got the planning solutions here, which help health systems predict what's going to happen with COVID. It's the core of which is the COVID scenario planner, which is the predictive foundation driving the elective surgery planner, the PPE planner, and the post-acute demand planner. Let's take a look now. So this is the scenario planner. It's a highly custom localized model that combines machine learning and 450 unique epidemiological models to predict COVID impact and demand for individual hospitals around the country. You can see right here, I've got Northwestern loaded up, my hometown of Chicago here, and we're going to predict and look at what the COVID admissions are by bed type. So we've got med-surg and ICU beds here, as well as the demand for ventilators and PPE. The tool pulls in the latest publicly available information on any hospital that you select. So we'll get beds and so forth. We'll also get the latest case counts, testing data, and other information to inform the models. The dotted lines here show when we're approaching or exceeding capacity for each of these resources. And then on the left side, we've got multiple sets of parameters you can adjust, from social distancing policies to different epidemiological inputs to build your scenario. And so as you build a scenario, you can save those here. And I've got 3 loaded up today, ranging from a mild case to kind of the worst case here in Chicago. So let's go ahead and take a look at the worst case scenario, where we see surges resulting from holiday gatherings in the coming months. All right, so you can see here that as I've loaded this scenario up, some of my inputs have changed. We begin to exceed capacity for med-surg beds here, as well as for the ICU. And then with these controls on the left side, allows healthcare leaders to do some game boarding and scenario playing to help mitigate running out of capacity. So for instance, if we can increase mask compliance, or if we get access to an additional 500 PCR tests per day, what can that do for our capacity? So I'm going to rerun the model here, and you'll see that it'll get us a little bit more breathing room on the med-surg census. I think GoToMeeting is kind of making my computer go a little crazy here, but once that loads, there we go. You can see that there's a little bit more breathing room under the med-surg capacity, but we're still running out of ICU beds in about 6 days. So then what we can do is we can hop down to the hospital inputs and add some surge capacity. So let's go ahead and add an additional 50 beds of ICU capacity and bring online another 25 ventilators to help us handle the incoming surge. And as that runs, it'll create some additional headroom in the ICU so we don't actually run out of capacity, as well as with the ventilators. And so this scenario then can be saved, and it drives the inputs into the surgery PPE and post-acute planner. So let's go ahead and take a look at what a worst case scenario might look like here in Chicago from a surgical capacity standpoint at Northwestern. So you can see as demand builds, it'll show you what types of procedures you can perform based on how you've configured your operating rooms. So we can perform some med-surg admit surgeries before the post-Thanksgiving wave of demand hits us, and then we can resume those as we're in between the kind of December wave and the downside of the Thanksgiving wave. We can't resume ICU admit surgeries until sometime in January based on our current predictions. Going a little further down, we can see what the census looks like by type of patient. So here's that purple is the patients receiving those elective cases. The gray is our COVID census over time in the med-surg unit. And so all this integrates together. These capabilities allow our customers to tightly manage their surgical procedures and maximize their revenue while it's safe to do so, providing much needed cash flow to offset the economic challenges of the pandemic. So that's an overview of how we're helping healthcare organizations manage through COVID, and we've achieved meaningful outcomes. Our model has proven to be 2 to 10 times more accurate than other widely known models, such as the University of Washington's IHME model, commonly referenced by media outlets and federal and state officials. Moreover, we're proud to have helped more than 1,100 organizations throughout this pandemic, from health systems, local and state health departments, to the highest levels of the federal government. Early on, we worked to support the White House COVID task force, and are now working in conjunction with Deloitte to support the Department of Defense from a pandemic and emergency preparedness perspective. Most importantly, though, health systems have been able to use these solutions to optimize their operations and better support the communities they serve. Here's a quote. Cuvinus developed an amazing predictive model that projects COVID cases and our enterprise-wide capacity, allowing us to optimize our OR utilization. It's been a tour de force. It's remarkable. Over the last 8 months, COVID has made our mission, which is to enable world-class operations in healthcare, more important than ever. And we're grateful to have been able to partner with so many organizations to make a true difference. Thanks.
Thanks so much. I'm going to welcome our judges back, and if Jeff's coming on as well, fantastic. All right, so we've heard a whole lot about hospital capacity in the recent years. Michael.
Fascinating presentation, and maybe I missed it at the beginning, but an ICU bed is a bed, but the resources of respiratory therapists and nurses, and the country's worried about EVS workers trying to make sure that the place stay clean. Maybe I missed at the beginning, but does your program or your technology define what a bed is, or is that simply from the user saying this is our capacity? Great stuff, by the way.
Yeah, so we pull all the bed data. Actually, it's physical beds. We pull it from Medicare cost reports and other publicly available sources. Ventilators aren't available anywhere, so we put in an estimate based on kind of our experience working with our clients on how many of those are usually on a per ICU bed basis. But the idea is to give our users kind of an intelligent starting point, and then they can override with what they know they actually have available.
Thanks.
So it's staffed beds is what we're pulling in.
And I guess related to that, I'll ask, I mean, an ICU bed is not an ICU bed depending on where you are. So, a smaller hospital is going to define an ICU bed as, a monitor and maybe the capability of a ventilator. A big, tertiary care facility is going to, have a much higher level of care definition. You're still just relying on the local hospital or the local care site to define for you what their capability is.
So we actually went through, and in the cost reports, they break out ICU beds by type. So you've got like pediatric ICUs, burn units, et cetera. I believe we excluded NICUs and PICUs, but we included all other types of ICUs in that initial starting point. So that should be what's driving the ICU number.
Yeah, but I think, to reinforce, a big emphasis for us is creating scenario planning capabilities. So the health system can go in and override any defaults that we're populating as they're running different scenarios. And that's what we most commonly see. The most important thing for us is to make sure that we have all the levers that they might need to pull so that they can scenario plan effectively, as well as make sure that the demand side is fully accounted for. What is going to happen with the pandemic, and what's the level of care of patients that are going to be coming in over the next few weeks? And that's the piece that that they can't get elsewhere, and that we're helping provide.
Yeah, I don't want to stomp on Chris because I know he's got a question. Just make a plug for the Children's Hospital world. I think your next iteration, looking deep into that lens, would be important.
It's a wonderful thought.
Right. Fascinating, impressive presentation. It's taking a lot of community data here, but are you looking at and paring it down to a specific facility to do predictive analytics, I guess, around what their loads are going to be? Are you contemplating like what the capacity may be in other adjacent facilities as well? Is there sort of a distribution model in that, or do you need their individual engagement to understand census? And is it just impacting this one facility versus what is the aggregate on the community?
Yeah, we would love to have like the live census data, but unfortunately that's not available publicly. What we do let folks do is pull in multiple hospitals. So I could pull in like the immediate hospitals here in Chicago, as well as Northwestern, and run scenarios on the entire geography. What we've actually helped some other organizations with around the state of Minnesota and a few other places is kind of had a weekly panel with the CMIOs of the different hospitals to help them align on the assumptions that they're using in our model. And then they can kind of sync on what their current census is and have different levels of surge planning available.
Yeah, Chris, it does account for all the expected demand in really every hospital across the country at all times. So it is factoring that in. And then as folks update the detailed census, it might be off by 5 or 10%, because we're using estimates and they might override it with their exact case counts. I was just on the phone with the state of Minnesota. So every health system in Minnesota is aligned on using this collaboratively. It's been really wonderful to see. So they update their projections together. They override all the different hospital defaults, and then they review that on a weekly basis to plan as a state for how they're going to manage their capacity. So it's been neat to see some of those communities come together around these types of planning tools, but there are always, I think, reasonably strong estimates of what's happening at the hospital down the street available to you if you don't have that same sort of engagement from other hospitals in your community.
Gotcha.
And one last note to further improve that, we pull the local demographic data based on 2018 census estimates. So we can remix the COVID estimates for your local geography, and the models are built around hospital referral regions. So it's essentially a healthcare market is what you're looking at for each of the hospitals.
Great.
We have like 30 seconds left. Everyone has a last follow-up question. Oh, you still know judges in the silence there, Anthony and Jeff. Thanks so very much. Thanks so very much. That was Cuventus, Anthony, Norman, and Jeff. That's our second of 3 presentations. And if I can turn their cameras off, I'll now introduce the third and last in this health system pandemic site. This is Kimberly Cerrone, CEO of Teatros, and Seth Norman, COO of Teatros. And they are a mental health social support platform. It combines a whole bunch of stuff, as you'll see, clinical expertise, peer communities, and technology, all about advancing the mental health right? And getting to sort of behavioral change and resilience. Now, before the pandemic, TIATROS has done a lot of work with another group of a group of soldiers, or many soldiers and servicemen who were suffering from PTSD. And basically they've entered this challenge because they want to take these tools to another group of extremely stressed professionals, obviously the frontline people working in hospitals and health systems. So right now, they're going to show you how they do that.
We created TIATROS to heal combat veterans whose mental health deteriorated because of the extraordinary demands being placed upon them. They urgently needed ongoing emotional support and effective psychological care. Seth is going to demo our solution to show you how TIATROS can help overworked and emotionally distressed frontline healthcare workers who are fighting their own war.
All right, so without further ado, this is what it would be like for a frontline healthcare professional to use TIATROS's HIPAA-compliant platform to log in from any internet-enabled device from either their place of work or at home, and whenever their busy schedule allows them to. And what makes TIATROS really special and what allows us to really engage our users is our focus on not just developing individual mental health and well-being skills, but on the transformation of organizational cultures. So on TIATROS, participants work alongside their fellow healthcare workers, getting to know one another while sharing the burden of their responsibilities and strengthening the bonds of community. And just like veterans of Iraq and Afghanistan who we helped through the process of post-traumatic growth, this is a population that responds very well to a sense of responsibility for helping other people, and TIATROS lets them shift the focus away from personal stigma and towards a sense of shared purpose. Now, also unique to TIATROS is our balance of synchronous and asynchronous participation, which allows time-constrained care providers to maintain this peer group cohesion, all while working through our programming at their own pace. And so what that means is each week, they're going to enjoy a new set of expert-led, high-value content that teaches the principles of cognitive behavioral therapy. Now, this work will include watching psychoeducation lectures presented by healthcare professionals who can both speak to the psychological condition of burnout as clinical experts, as well as the personal experience of burnout as fellow healers. They'll also go through and work on a battery of evidence-based journaling and written exercise prompts, which will help these folks begin to understand and share with each other their own personal experiences of burnout. And meanwhile, all of this work is done while tracking and managing not only the clinical measures of burnout and stress, depression, anxiety, and so forth, but also the personal emotional growth that comes from doing the work together. Most importantly is that while all of this is being done on an individual schedule, the participant is constantly encouraged to both give and receive feedback to the rest of the peer group. Ultimately, burnout is a condition driven by the sufferer's sense of disconnection from the meaning and mission of their greater organization, by a sense that they lack the resources necessary to affect positive change. But what makes the TIATROS experience unique is our patented process for bringing different people together and giving them the tools and resources they need to transform not only their own lives, but their entire workforce. And long after a peer groups program is completed, frontline healthcare workers are able to stay on our platform, continuing to communicate with each other, as well as with other peer groups that have graduated from our burnout program, and use our communication tools and exercises to continue cultivating real-world cultures of well-being as they choose to define that word. It's ultimately by giving healthcare professionals the skills they need to heal themselves, as well as the tools they need to collaborate and support each other, that TIATROS becomes not only a highly engaging and effective means of overcoming the burnout crisis, but it becomes a highly scalable and affordable solution for healthcare systems.
Thank you, Seth. 100% of veterans improve their mental and physical health on TIATROS, with most moving from the moderate to severe clinical range into the normal range of mental health. Up to 95% complete their Teatros program and show empirical proof that their ability to cope successfully with work and life-related stress dramatically improves. We've published peer-reviewed scientific reports that show behavioral attributes associated with mental well-being, improved physical health, increased productivity, and effective teamwork dramatically increase. We can do the same for frontline healthcare workers, getting them the emotional support and psychological care they urgently need. Thank you.
Thank you. Fantastic. Could our judges come back, please? I know we are running up against the clock here, especially I know for Till and Michael. So Till, do you have a comment or a question?
Yeah, very important work. I guess one thing I would ask is related to the, I don't know if competitive landscape is the right word, but term, but you know, there are various applications in the behavioral health sphere around this area. How do you differentiate yourself from those?
I would answer, the first piece of that answer is our work to deliver true help. We build everything to the highest standards of cognitive behavioral therapy, and we've built these tools out with our expert partners in the field. This isn't that Teatros is based on, you know, cognitive behavioral therapy techniques. It's that we adhere to all of the clinical standards and the entire process for delivering it in a group. So I would say, you know, the highest standards of care and tracking, but more than that, we have found a way to balance, and I mentioned that synchronous and asynchronous participation. We balance the, you know, week to week scheduling needs of very busy people, but still ensure that they're coming into the platform together and getting the work done. They're not just signing up for something and not completing the work. So that engagement piece is also a really big factor. But at its core, if I could only name one thing, it would be our social approach and our group approach. At the end of the day, CBT is fantastic for individual mental health and well-being, but really, and in particular for folks like veterans or folks who work in the healthcare system, you alone are not enough. You are part of a huge team that has a whole culture that needs help. And so what we're really doing is helping people not just change themselves, but begin to talk about transforming their own communities and organizations.
But I would like to add one thing to that. As Seth said, we are among the relatively small handful of digital health companies that are completely evidence-based. We insist upon that. Every implementation of Teatros is independently validated by independent research psychiatrists and psychologists. That's how we get better and better, and we publish all of our data.
Mm-hmm. Chris?
Sure. Till, I want
to thank you, and Michael. I know you guys have to drop right now, but I see you've got your scores in, so thank you very much for that. And Chris, your turn.
I've got some work to do too. Great. Well, thank you both. Incredibly important topic and timely. You're watching the news any given evening now. The stress is incredible. You addressed this a little bit, Seth, but how are you driving that engagement? I mean, it is fascinating. I understand the benefits of the peer groups and things like that, but how do you, are you going to nursing units? How does that actually manifest in the organization? Is it just by making it available? I mean, I totally appreciate in the military side, it is post-traumatic, right? But these are people who are in the throes of it now, and making time and getting them while they're in that dire critical need, and getting graduate from that burnout session is fascinating.
Yeah, so I could give you an hour-long answer to this question, and so I'll spare you and I won't. But with the short amount of time that we have, I'll speak to that. Our platform is really robust and flexible in terms of not just the programming, but also the sign-up process and engagement process. And so we work with each individual implementation to ensure that the leadership is buying into how Teatros works. And that's a really important component too. This isn't the same as signing up for your own app. It's sort of buying into, hey, we're an organization that wants to transform the culture. Now, whether that means the organization is, we're going to work together for emailing their people or coming on site and giving presentations, that we do and work with the individual customer. But I would say that, in the broadest sense, that engagement is driven by, this is probably a poorly timed joke, but it's a viral adoption. It's part of the greater community and other members and leaders at the junior level coming together and inviting people to go through programming with them.
So they can invite one another, et cetera, and grow it from there into that group.
Yes, precisely.
Absolutely. I would also add to what Seth said is we've worked very hard to find our users where they are. For some healthcare workers, what they need preventive services. They need emotional support, individually, cross teams, across entire organizations. We see, but on the other hand, we see clear signs that many of our frontline healthcare workers are dangerously close to burnout. They need effective evidence-based psychological care that is delivered in a form factor that is palatable to them, that can reach them where they are with everything else going on their lives. So we optimize to meet the needs of individual users. We use a lot of advanced artificial intelligence technology to understand what they're asking of us and deliver it. And we also give feedback to them at the individual level on how well they're doing managing the enormous stresses they're under. And we give de-identified, aggregated information to their healthcare, their company's leadership, so they can make the structural changes that are required to help frontline health workers.
Makes great sense. Yeah, wonderful.
Fantastic. All right, thank you, Kimberly. Thank you, Seth from Teatros. Thank you for everyone for sitting through the the technical gremlins.
My apologies.
Right. Thanks, and Kimberly and Chris, you can take your camera off now, please. And I'd like to hope that she's out there to invite Kathy Hempstead to come on from Robert Wood Johnson Foundation. Thank you very much again for finding some very, very important work. Perhaps you'd like to say a couple of words about where the foundation is on this whole topic of emergency preparedness and what you're planning for the future, and also what you saw today.
Well, I wanted to thank everybody. I want to thank the judges and I loved seeing all the finalists. I wouldn't envy the judges. I think these are really tough decisions they have to make. I don't know why my camera's not turning on, but you'll just have to imagine that it is. And we are just more than thrilled with what you've been able to put together with this challenge and the people that responded. And also, I was really excited with what you debuted, your own database of different companies in this space that are working on COVID and what it might grow to after that. So I think that we will continue to be looking for opportunities to be helpful in the COVID space. We're doing some really interesting data availability work out of Health Data for Action and a couple of other surveillance projects. So if anybody has any great ideas or wants to get in touch with me, you know where to find me, and I'm sure we'll be setting up another challenge soon. And I'm sorry that I'm an unseen voice, but I must have the wrong webcam configured. And I know we're tight on time, so I'm gonna just.
Well, you were the one person we didn't. You were the one person we didn't check in advance of what you should have done. We checked everybody else, and somehow we still have the tech gremlin bugs for Seth from Teatros.
Oh, I know what it is. I know what it is. Hold on. I think I'm looking.
You have the cap on over the top.
To the wrong camera. Try this.
Oh, there you are. Okay.
I exist.
Now she's gone. Everyone can see Kathy.
Yes, now that I'm here, I'm probably going to get off because I know we're late and a lot of people have hard stops. But thank you very much, Matt, Indu, judges, everybody. This has been terrific.
Okay, so I'm going to stand on here at a time. I'm waiting for the message, and I have. I'm hoping in my Slack channel in a second, I will see the answer. Sorry, on the general public side, we have a tie for first place, and here's the answer. Binformed and CovidSMS tied for first place. So you're not getting $25,000 each, I'm afraid. There isn't that much more money, but we will divide that up. Okay, Serena, Rick, do you guys want to come on really quickly? Rick, congratulations. Serena, you there? Oh,
Serena unfortunately had another interview to attend.
Serena,
We're still here.
So she's won. Well, Oren and Joey, Rick, I just want to say congratulations to you. Rick, congratulations to you and your team. And also, it was super, super close, I hear. So also congratulations to Stacey from Fresh Propel. No one is a loser here. You're all winners, but you two are tied to be the winners, and hopefully we can see some great progress in both of you. And maybe you guys can get together and do something together. So hopefully we'll go from that.
Oren, you and Joey, Sabrina, we cannot tell you how much we appreciate sharing this with you. You guys are doing phenomenal work. Thanks a lot for everything you do.
Thank you. Yeah, we're just so happy to be here, to be competing with people who, like really know their stuff in the industry. And we've been learning so much from you guys just from listening to all the presentations today. So thank you for having us here.
You're awesome.
All right. Thanks so much.
Congratulations.
Thank you.
Thanks so much. And then on the other side, we only have one winner. This one wasn't quite as close. On the healthcare system side, it's Cuventus. I don't have a check written down for you because I had to change the other check. So if you're there, here we go. Anthony.
Thank you so much. We're super honored. I mean, it's a great company to be in, and wow, what an honor. Thank you so much. Jeff had to drop. He's in an strategic planning session, but
over time. But okay.
I really appreciate it.
So congratulations to Juventus. Congratulations to Binformed, and also to Binformed, and also to CovidSMS. Congratulations to everybody who took part in the challenge. There were hundreds of entries for both categories. So we're really over 100 entries per category. So we're really thrilled. Thank you very much to Kathy and her team at the Robert Johnson Foundation for sponsoring the challenge. And with that, we are wrapped. Thank you all for being on and watching. And we look forward to hearing much more about these challenges, sorry, these solutions for pandemics and emergency in the future. It's Matthew Holt from Catalyst signing off. Thanks now.